Children with stomach flu who arrive at the Alberta Children's Hospital Emergency Department will soon have the option of participating in a national research study examining the effectiveness of a probiotic. The multi-center study is the largest of its kind in North America and will test nearly 900 children ranging in age from 3 months to 4 years.
So this study is actually evaluating the beneficial effects of a probiotic supplement in children who present for emergency department care with vomiting and diarrhea to 5 different pediatric emergency departments. And what we're looking at is the potential beneficial clinical impact on these children.
Dr. Friedman's study will look at the effectiveness of a specific probiotic called Licidofil, which is a combination of 2 live bacteria strains that have shown promise as a treatment for gastroenteritis in both laboratory models and clinical trials.
At present, have very little to offer parents whose children suffer from diarrhea. Generally, we say to continue just oral rehydration, watch for signs of dehydration, and we give them some red flags that we tell them to be concerned about to come back for further emergency department care. What this will do actually, it'll give us a potential option that we may recommend to parents that they can use to help reduce the child's symptoms and actually modify the course of the disease as opposed to just treating ongoing symptoms.
Mum Jamie Smith became concerned when her 18-month-old son Rylan became ill earlier this spring and spent several days with bouts of diarrhea and vomiting.
He was sick for about 5 days with vomiting and diarrhea, and it just didn't show any signs of slowing down. So we brought him to emergency, and they approached us regarding the study, and I figured it was a great idea. If it could help him in any way, then it was worth it.
Children enrolled in the study will be given either 10 doses of Licidofil or a placebo, and then monitored for 2 weeks to measure a comprehensive list of outcomes, including symptom frequency and intensity.
Probiotics, by definition, are live microbial organisms beneficial to the host. We don't say just take an antibiotic. We actually prescribe a specific antibiotic, a specific dose, a specific duration for a specific disease. Probiotics is very similar, and that's why we are actually studying a specific probiotic at a specific dose that we spent time being comfortable with for a very specific disease in a very specific group of children.
Although parents aren't told whether their child receives the probiotic or a placebo, Smith says her son improved soon after the visit to the hospital.
We just saw his demeanor change, him, become the happy little boy that he usually is, instead of, a sulky little cuddly boy that doesn't want to do anything. When little kids are sick, it's so hard to see them sick, and leaving them with somebody else isn't exactly, what you want to do. You want to be home to care for them and to help them. And the faster they can recover, the better for both of us.
It's potentially a very big benefit to not only the child, but their family as well. And there's also some potential economic savings to the healthcare system if children can be treated at home, managed more by their parents because they have fewer symptoms, and hence not have to seek care. And there's also a large potential benefit to society in terms of caregivers not having to miss work if their child's symptoms resolve sooner. Kids can return to daycare or school sooner even.
We don't know the results right now, we're just waiting for them, but again, if it was something that we could do to benefit him and other kids to get better sooner, it was definitely something that was worth being a part of.
We anticipate to have a significant amount of the data analyzed within 6 months of the completion of the study. So hopefully by the end of 2016, we'll be able to provide some recommendations regarding the results and our findings.